when people call the Clarity Care Consulting Office, it is often about, how much care costs and how they're going to be dealing with paying for care generally. Can you just tell us a little bit about care fees and how that works?
Okay, absolutely. So most people will worry about inheritance tax, and they will say, "But we've got to make sure that we don't have to pay inheritance tax because we want to pass on money to our children, our family." Most couples with children will have an inheritance tax allowance of £1 million. Now, I mention that because lots of people worry about paying inheritance tax when they don't have to pay it because they're not rich enough. Care fees, on the other hand, if paid, will reduce your estate down to potentially £14,250. The government will only assist your care fee with your care fees when you get to 23,250. So if you have a couple, then there's an awful lot of money that can be spent on care fees before you get any government help. So in my head, people should worry more about care fees than inheritance tax. So the way it works is people move into care. If they've got more than £23,250, they are going to pay privately, self-fund is the terminology, until their capital gets reduced down. Sometimes the local authority might jump in and pay sooner if there's a property, which might be ignored for 12 weeks, but then will come into play to allow time for people to look at matters. But at 23,250, the local authority will look at pay. Now, the trouble is, as we all know, care fees privately can be 1,000, 2,000 plus a week, whereas the local authority will pay less. The important thing that people need to understand is that when a local authority say, we will pay up to £900 a week towards your care, they don't mean we will pay £900 a week towards your care. What they will do is say, what's your income? Do you have a state pension? Do you have a private pension? Are you on attendance allowance? What actual income do you have? So just as an example, if you've got £300 of income a week, then you're going to pay £300 towards your care, and the council will top it up to 900 to get to the 900.
Can I just clarify? That's when people are moving into a care home, isn't it? That those sort of figures roughly, rather
Yes,
than people staying at
yes,
home. Yeah, that's fine. Just wanted to
yes,
clarify.
yes.
Yeah.
So this is going into care. The other issue is when people run out of money in care. So they've lived in a care home and they've spent all their money on care. You've then got a situation where the council will come in and contribute, but again, they're going to look at whether or not the home you are in is within budget, and that can get quite complicated. What frequently happens when people move into a care home is that the family like a care home, but it's going to be way over the council budget. So then they think we can use the attendance allowance, we can use the state pension to pay for it, which they can't. When they discover this, the council might then say, but you can top up, a family member can top up. And that can be hundreds of pounds a week. And there's not many of us that can afford hundreds of pounds a week towards care. So for all of these situations, you have people who you need to make an educated decision about the care home you're choosing. You need to understand the finances of who should pay what. If you are a spouse, you are not liable to pay your other half's care fees. They pay their care fees. Now, that might be fairly straightforward. But if you've got a situation where stereotypically husbands were advised to put all of the assets in the family into the wife's name because they weren't working, they weren't paying tax, if that person, that lady, then goes into care, you can end up with a situation where all of the family money is now going on care fees, and
Mm.
the husband is at home going, but that's all our savings gone. So
we
it's
do hear that a lot. Sorry, we hear that a lot. Where that's happened,
yes.
yeah, which is quite frightening for families, isn't it?
It is because there's nothing you can do about it.
Mm.
So it's making sure that you understand that while lots of people are given advice about tax, like I said at the beginning, inheritance tax, lots of people are given advice about income tax and things, it's actually understanding that care fees could be the bigger problem for that you're facing and how that's funded and who pays for what than worrying about a tax that may or may not be payable at a later date.
When we also have families that come to us who they often, as I do, we have joint bank accounts and things as well. But it's definitely the individual's money that is taken. So what happens if they've got a joint bank account as far as
Yeah.
care
So if
fees are
they,
concerned?
yeah, so if they've got a joint bank account, most of the time, um, if they're at home getting care, then we just leave it alone because you've still got all the bills and you've still got all the payments. What we might do though is move the attendance allowance, if they, well, they will be entitled to it over to a different account, and maybe just rearrange money slightly so that it's clear who's paying for what. However, when you're going into care, if there's a joint bank account, I'm going to suggest splitting the account so that the person in care, all their money is separate and it's quite clear that their money is being paid for care, and that the person at home has their money um, and that they are getting what they're entitled to, but so that they're not paying for their other half's care. What we don't want is a situation whereby there are lovely people out there who pay for somebody else's care thinking they're doing the right thing because they're paying for care, it's all being done, and then discovering when they need care themselves, the local authority is saying, but you spent all your money on somebody else's care, we're going to treat you as though you still have that money. So it's understanding what your position is, um, splitting joint accounts so that it's very clear whose money is who, making sure the income goes to the right person, um, and that that money is then spent on what they need, be that the person at home or be that the person in care.
Thank you. I think that's it's still such a difficult thing for families to get to grips with, because again, it's something one of those things we don't know it until we're sort of thrown into it. But thank you, and I know that you've helped a lot of families for us on that. Thank you very much.